is Dr. Larry Cheskin. Dr. Larry Cheskin has been a friend to Medifast and Take Shape for Life for over 2 decades. He is the founder of Johns Hopkins Weight Management Center and literally is one of the leading researchers in obesity in the world. He is here today, once again, as a friend, as a colleague, and as a strong advocate of what we are doing. Dr. Cheskin.
What I want to say is really very simple, because you've heard very eloquently from my colleagues here what the challenges are and what the charges to all of us, both those who are traditional healthcare providers and those who are health coaches. And they're really very similar. And the challenge is to empower our patients, if you're a healthcare provider, or your clients, or whatever you want to call them, your friends, if you're a health coach, to take charge of their own health and to make these changes by motivating, by serving as role models, by teaching. And there are some very big barriers to doing that, though, and you've heard some of them very eloquently described. Traditional healthcare does a very poor job of that, and its focus is entirely different. And so what we need to do is both educate and, in some ways, to change the way healthcare is delivered. And you are agents of that change and represent truly the future of healthcare. And traditional healthcare has been called essentially doctor-centered or paternalistic. So we tell you what to do, you should do this, do it, and if you don't do it, it's your fault, you're not listening, you're not compliant. That's the traditional model of healthcare, and it's still pretty prevalent. There was a reaction to that occurred a number of years ago now, and it created something called consumer-based healthcare, which is kind of the opposite. The patient is in charge, and the doctor or the healthcare provider is just a technician and is paid for their services, and the market basically dictates what the healthcare provider does. If there's demand for treating obesity, then doctors will flock to it because they want to make money, and the market is determining the outcomes. The patient is essentially in charge. The traditional way of synthesizing those two is to say that this is now a patient-centered, which doesn't mean that the patient is in charge, but the patient is at the center of the model, and the provider is assisting the patient. So it's a shared responsibility between the patient and the healthcare provider. That's the standard synthesis. The future, and I think Take Shape for Life very well represents this future, has been called by some relationship-centered. So we're moving away from either the doctor or the patient calling the shots and determining the control, but to it being a relationship between the patient